The Breast Cancer Index, or BCI test, is the established test exclusively recognized by guidelines to help inform decisions about extended endocrine therapy for patients with early-stage, hormone receptor-positive breast cancer based on their unique tumor biology. Traditionally, the BCI test has been used near the 5-year mark to help determine whether an additional 5 years of endocrine therapy is likely to reduce a patient's risk of late, distant recurrence. New data supports an expanded indication for the Breast Cancer Index test, which will unlock earlier insights and enable physicians to set clear expectations around a patient's endocrine therapy treatment plan from the very beginning. Navigating the new order options for the BCI expanded indication is important to support decision-making based on a patient's menopausal status and when you are considering ordering the test. Specifying the testing option based on the patient's menopausal status helps provide refined recurrence risk estimates and informs different clinical decisions in the adjuvant setting, which will be reviewed in a moment. Note that postmenopausal status is typically defined as 12 months without menses or an estradiol level of less than 10 picograms per milliliter. Dependent on menopausal status, postmenopausal versus premenopausal, there are two options for testing: a full 0 to 10-year report option and a 5 to 10-year report option. The 5 to 10-year report option most closely resembles the traditional breast cancer index report, delivering established, guideline-recognized results to support extended endocrine therapy decision-making. This single-page report will continue to provide the patient's likelihood of benefit from extended endocrine therapy, as well as the patient's risk of late, distant recurrence, years 5 to 10. This option is most appropriate for patients approaching or at the 5-year mark, deciding whether to stop endocrine therapy at year 5 or continue to year 10. This option may also be considered for patients beyond year 5 to predict whether continuing endocrine therapy to year 10 is likely to be beneficial, or if the additional exposure to side effects and toxicities may be avoided. For earlier treatment planning, a new, full 0 to 10-year report option is also available. In addition to the results to support extended endocrine therapy decisions, which will be included with all BCI test options, the new, full 0 to 10-year report option includes additional prognostic results for 10-year distant recurrence to support earlier endocrine therapy treatment planning. Together, these results can help set clear expectations around a patient's endocrine therapy treatment plan from the beginning, specific to the patient's menopausal status. Selecting the full 0 to 10-year report option for postmenopausal patients helps inform endocrine therapy duration: 10 years, 5 years, potentially even less. Meanwhile, selecting the full 0 to 10-year report option for premenopausal patients helps inform potential omission of ovarian function suppression, as well as 5 versus 10 years of endocrine therapy. The full 0 to 10-year report option may also be appropriate if a patient is already on endocrine therapy and within the first few years of treatment. In this situation, results may be valuable to either help gain comfort in potential de-escalation or, alternatively, gain commitment to treatment plan adherence. Whether ordered at diagnosis, within the first few years of treatment, as the patient is approaching year 5 or even beyond, the expanded BCI order options are designed to provide flexibility, ultimately enabling clearer and more personalized endocrine therapy recommendations for patients with early-stage HR-positive breast cancer. For any questions regarding how to order the Breast Cancer Index test, contact your oncology account executive or the Biotheranostics Client Services team. To order the BCI test, visit hologic.com/breastcancerindex.